In 2016, the Center for Disease Control reported that in the United States, there were 116 deaths every day related to an opioid overdose. There were also 11.5 million people who misused opioid prescriptions and 2.1 million people who had an opioid use disorder.
I've had multiple people in my life that I've seen misuse and become addicted to opioids. Most of the people that I know someone, a family member, a friend of a friend. You're really lucky if you don't have to see that in your life. We chose to use Click as our tool to address the opioid challenge because we wanted a tool that was able to show the data in a variety of different ways so that we could identify key issues within the way that we were currently prescribing opioids and find opportunity to change those. Every day that a patient takes opioids, they have a higher likelihood of becoming addicted. A lot of the literature supports for acute pain giving no more than a 3-day prescription, and at most not giving more than 7 days. Within the app, we were able to identify that a lot of the scripts that were written were for 7, 10, and 14 days. We then worked with our build team to say, why do we need buttons for 7, 10, 14 when we really don't want people prescribing 7, 10, and 14 days unless absolutely necessary? So we changed that button to just a 3-day button, and we've now seen a decrease in prescriptions of 7, 10, and 14 days by 50%.
When we looked at the baseline data in Click, we noticed that we didn't have a way to compare different types of opioid prescriptions, so we could not compare pills to liquids. When we then were able to put this in the system, we were able to calculate that in Click. This then allowed us to track our morphine equivalents per prescription. We saw a decrease in the morphine equivalent daily dosing by 11%. The overall reception about the Click application by providers was very positive. We presented this to our department chairs, and they were very excited to finally have this data. Before Click, we had no way of being able to give them the baseline data for them to monitor prescription trends.
Data and analytics in the healthcare field is relatively new. So it's really our goal to help market this Click app, to really help get the data out there and educate. Currently, we're able to slice and dice this here at Center City, but we'd like to move that over to Jefferson, New Jersey, Jefferson, Northeast, and Abington. So really across the board, we're doing our part to show what our prescribing patterns are and help in any way that we can. It's really important to try to do as much as we can at the point of contact when we have that patient with us. And the decrease in duration and the decrease in morphine equivalent daily dosing that we're seeing is impacting hundreds of patients here.